Coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, says the federal government remains committed to strengthening Nigeria's primary healthcare system. At the 2025 Joint Annual Review held in Abuja, Professor Pate announced that the federal government has achieved 84% of its key health reform targets.
Key players from across Nigeria's health sector converged in Abuja for the 2025 Joint Annual Review, a yearly assessment of progress toward universal health coverage.
Bringing the Nigerian health sector to light underscores the fact that transparency, accountability will help ensure that we make the progress and be able to tell that story of our progress in a measurable way. It also challenges us to hold ourselves to the highest standards and to welcome the scrutiny of all those we serve. This year's year builds on the baseline that we set last year and serves as a crucial accountability tool that allows us to track this progress, identify the gaps, and chart a unified course towards better health outcomes for every Nigerian. It will assess health sector performance on key indicators that we had agreed and feature the signing of an updated compact with an addendum to include local government areas, private sectors, traditional religious leaders, and the CSOs.
A major highlight was the signing of an updated health sector compact expanding collaboration to local governments, private sector players, traditional rulers, and civil society. Maternal deaths have dropped by 17%, newborn deaths by 12%, while skilled birth attendance now stands above 90%.
As a result, the compact, which was originally signed in the presence of His Excellency Mr. President, will now be better positioned to further drive our progress towards universal health coverage. Our goal is clear: universal health care for every Nigerian, regardless of location or income. To achieve this, we must advance the localization agenda of the health sector.
And let me join others, so many others, starting from the representative of the Sultan of Sokoto, in commending not just our indefatigable, highly capable, energetic, and world-renowned Honorable Minister of Health and Social Welfare, but importantly, his whole team, his Minister of State, his SSA, and the entire team that have shown such capacity and such capability over the last 2.5 years in particular, and have innovated so well.
I think one of the things that I've seen since Minister Pate took office is that his word and his action, there is not a big gap between the two. Quite often I travel to London, and when I get out of the train, it says mind the gap. And minding the gap means that we must always make sure that our rhetoric and our reality does not have a distance. And Minister Pate, congratulations for minding the gap.
With fresh commitments and broader partnerships, the Minister of Health says the renewed compact will help deliver better care to millions and strengthen the nation's journey towards universal health coverage.